Hello and welcome to CBC's volunteer training on the Health Insurance Portability and Accountability Act, otherwise known as HIPAA. In today's training, we will be discussing what HIPAA is, how we implement it here at CBC, and what to do if there is a breach to HIPAA. HIPAA, or the Health Insurance Portability and Accountability Act, is a federal law created in the late 1990s that requires all healthcare providers to ensure the privacy, confidentiality, and security of the health information for every person. These new standards provide patients with access to their medical records and more control over how their personal health information is used or disclosed. HIPAA represents a uniform federal set of privacy protections for consumers across the country. State laws providing additional protections to consumers are not affected by this new rule. HIPAA has four main parts to achieving its goals. The first part is related to healthcare access, portability, and renewability. This protects health insurance coverage for workers and their families when they change or lose jobs. The second part is dedicated to reducing healthcare fraud and abuse. HIPAA looked to find ways to ensure healthcare was used correctly and did this through the third key part, standardization. To standardize healthcare, national standards were created for electronic healthcare transactions and national identifiers for providers, health insurance plans, and employers. The provisions also address the security and privacy of health data. The third part relates to the privacy related to healthcare. HIPAA also instituted the rights of privacy, which requires the health providers must have a signed disclosure from individuals before releasing any information related to their health care. The fourth part, and the focus of this training, is the protection of confidential protected health information, or PHI. The way HIPAA protects PHI, or protected health information, is through two main rules, the privacy rule and the security rule. The privacy rule assures that individuals' health information is properly protected while allowing the flow of information needed to provide and promote high-quality health care and protect the public's health and well-being. Essentially, the privacy rule looks at balancing the rights of the individual while allowing healthcare providers the information they needed to protect patients and the public. You may be wondering what exactly constitutes protected health information, or PHI. PHI can be defined as any information about health status, provision of health care, or payment for health care that is created or collected by a covered entity and can be linked to a specific individual. In more general terms, it can be defined as a unique identifying piece of information about an individual. A few examples as indicated on this slide are name, address, phone number, social security number, birth date, or photos. While CBC is a covered entity under HIPAA, certain situations require the release of PHI to facilitate care or operations. HIPAA has included guidance for when PHI can be disclosed in three main scenarios, called TPO. First, PHI can be disclosed for treatment and providing care. Physicians are able to share PHI with other practitioners providing care to an individual. HIPAA also allows the disclosure of information in relation to receiving payment and to the business providing medical services. The third category where HIPAA information can be released is healthcare operations. This allows for streamlining processing of care. While these exceptions exist, HIPAA still establishes guidelines related to the amount of information disclosed. Under the minimum necessary rule, a covered entity must make reasonable efforts to use, disclose, or request only the minimum amount of protected health information needed to accomplish the intended purpose of the use, disclosure, or request. It requires the balance of information be equivalent to the task at hand, no more, no less than what is required to provide high-quality health care. The next step to protecting confidentiality is including protections in our everyday practice. By implementing the rules in simple to complex work procedures, we ensure PHI remains confidential. Ways to protect PHI in our service or work is be aware of your surroundings when talking, shred or destroy PHI before throwing it away, do not leave PHI on answering machines. For example, if you are reporting a possible breach of confidentiality, you would call volunteer services and state, "I have a concern regarding a breach of confidentiality. Please call me back." Do not leave information about the situation, who was involved, or what was said to ensure the information remains confidential. Check printers and faxers and copiers after use. Do not leave PHI in plain sight when not in use. Ensure areas where PHI is stored are locked and secure when not in use. Confirm all faxes were sent to the correct fax numbers. Include a confidentiality notice in all fax cover sheets and emails. As we have now covered the privacy rule and protections of PHI for written and oral communication, the next step is the security rule. The security rule establishes a national set of security standards for protecting certain health information that is held or transferred in electronic form or ePHI. Unlike the privacy rule, the security rule focuses only on PHI transmitted via an electronic medium. The security rule focuses on ePHI, which is defined as all individually identifiable health information a covered entity creates, receives, maintains, or transmits in electronic form. The security rule does not apply to PHI transmitted orally or in writing. A few examples of ePHI include PCs with internal hard drives, external portable hard drives, magnetic tape, removable storage devices such as USB memory sticks, CDs, DVDs, PDAs, and smartphones, email and file transfers. Similar to the privacy rule, the security rule also has specific actions to help ensure confidentiality for ePHI. A few examples are: never share your passwords, do not store ID codes or passwords near terminals, prevent observation of entry of your ID codes and passwords, download ePHI from CBC's computer system onto other electronic media only with written permission, prevent unauthorized individuals from viewing confidential information on the computer screen, report potential computer threats to IT and monitor your computer operations, access need-to-know information only, and use password-protected screensavers. While we have all these precautions and rules in place, unfortunately, breaches of confidentiality occur. In the event that you feel you may have disclosed confidential information or witnessed others disclosing PHI, it is your responsibility to report these breaches to your nearest CBC supervisor or volunteer manager. If neither are available, you also have the option of contacting the privacy officer. To contact the privacy officer, contact 816-753-4040 and ask for the privacy officer, Barb Blake. Thank you for attending our volunteer training on HIPAA. To receive credit for your training, please take the quiz at the link in the description box below the video. If you have any questions, contact Volunteer Services at 816-854-9553. Thank you.